Hello, welcome to Drug Talk. I'm Matt Hamilton. Today we're talking about the drug Pradaxa, how it's used and why it's used, errors that can be made in its use, the effects on the human body, and what to do should an error be made. I'm joined here today by Dr. Jesse Garcia. As you know, I'm a trial attorney specializing in drug errors, and I represent the victims of those drug errors. But Dr. Garcia, what is your area of specialty?
I am a clinical pharmacist specializing in drug errors and the effects on the human body.
Okay. What is Pradaxa?
Pradaxa is in a class of drugs known as anticoagulants. So it's basically a drug that helps prevent clotting.
Okay. Why would somebody be prescribed Pradaxa?
Pradaxa is used for a number of different things, depending on the purpose or the reason why you need that anticoagulation. In some cases, we see it with patients who have had a pulmonary embolism, which is basically a clot in the lungs, atrial fibrillation, which is a quivering of the heart that can cause basically a blood clot.
If I'm an ordinary person, you say anticoagulant. What as a practical matter does that mean?
It basically just means that we're trying to prevent a clot from forming.
Okay. And blood clots you don't want because they can hurt you or kill you.
Correct. They can move to the lungs, cause issues for you there, get into the heart attack. You could have a stroke. You could have basically, it's called a D.V.T, which is a deep vein thrombosis, which is basically very painful clot in the leg.
Now, stroke's just basically a drug clot in the brain.
It's basically, a blood clot that's made its way up into the brain.
Okay. And Pradaxa helps prevent these or treat them?
It can help prevent the clot from ever even forming.
Okay. Can errors be made in the prescription or use of Pradaxa?
Correct. You can see that with Pradaxa. Pradaxa comes in two different strengths, and the dosing is going to be subject to certain conditions. So you might pick the 150 milligram dose for some patients and then a 75 milligram dose for others.
Well, how do the medical professionals tell which dose should be made?
Well, that's a good question. So there's a function test that is used. Basically, it's called a creatinine clearance. It's basically a kidney function test. So we use that to help determine which dose that we would use. And Pradaxa is unique in the dosing because it's a twice-a-day dosing. So, which is different from some of the other medications that are one-a-day dosings.
So they might not realize that it's twice a day, or they might not read or interpret the kidney test right.
Correct.
Okay. Are there any weight issues with Pradaxa?
Pradaxa in and of itself has not been studied in patients that are extremely morbidly obese. So over the highest range that you'll find in the literature for Pradaxa is a maximum weight of about 264 pounds. That's about the high end of it.
Okay.
So beyond that, there is no specific evidence that says, what dose to use. We would expect if they had good kidney functions, we would use the higher dose.
So the likelihood of an error for somebody over 264 pounds using Pradaxa is much greater.
Would be greater than someone below that weight.
Okay. Now, is Pradaxa used in combination or a sequence with other drugs?
In some cases, we do see Pradaxa used, sometimes even at the same time. So depending on what your end result or your end goal is, if you're going to, say, start a patient on another medication like a Lovenox, which we discussed, you will see them be on that medication for some time, and then they'll start the Pradaxa at the same time. And then after a couple days, maybe 4 or 5 days, then you'll see the Lovenox removed, and then the patient will just continue on with Pradaxa, or vice versa. You might start with Pradaxa and then go to Lovenox. It's just depending upon what the goal is.
Those are called what? Conversion errors?
It could be a conversion error, basically, where you're converting from one anticoagulant to another.
Okay. So errors can occur when you're switching from one drug to another, Pradaxa to something else, or from something else to Pradaxa, or even mistakes made because you're using two different drugs at the same time.
Correct. And in some cases, the packaging looks very similar. They're both white boxes. The only thing that you'll see different is just basically the striping of the medication, where it shows like basically the difference in dose. So you might have one color is the 150 milligram, and then you might see another stripe where it's a 75.
Is age a factor?
Age can be a factor in some cases. just depending on that. You might see where you have a patient who is elderly, where they may be more sensitive to the drug.
Well, okay, let's say that an error might have occurred. What sort of consequences would that have? I mean, what sort of symptoms would you expect if you're taking Pradaxa?
If you're taking Pradaxa, you would see kind of some major symptoms of basically hematoma, which is basically a pooling of the blood outside of the normal system being the heart and the blood vessels. You can also see some cardiovascular issues. Those are more if the patient has been maybe had previously had a heart attack, or if they've had some other cardiac condition, they may be more predisposed to have that. As with any of these anticoagulants, we also want to be mindful of blood in the stool. That's typically an indication. It's called bright red blood. If you see that, that's definitely an indication of some type of internal bleeding.
Okay. So if you're taking Pradaxa, you need to pay particular attention to unusual bruises in your body.
Correct. Hematoma would be a pooling, but you'd also want to be mindful of just large bruising that occurs that maybe you bumped yourself up against the wall, or you bump yourself on the door and you see a massive bruise, whereas you might have just seen maybe a quarter-sized bruise in the past.
Okay, so that's something you should pay attention to.
Absolutely.
Okay, well, what should they do?
This is not a wait and see, maybe call in the morning type of situation. If you're seeing active blood in the stool, you're seeing massive amounts of pooling blood, you're having those types of issues, you definitely want to get seen. So you'll want to take that medication, whatever box it was. Like I said, sometimes there's an issue with just picking the wrong box. So take what you have there, because what you were intended to take and what you're actually taking might be two different things. So take the actual medication itself.
Okay.
Take a list of current medications that you're taking beyond this, and definitely get seen.
Okay. All right. And so if they see right away, don't wait until the morning. They want to take the actual drug that they're taking and also the list of all the medications they've got as well.
Correct. And it's important to make sure you bring what it is you're taking in terms of your anticoagulant, in this case Pradaxa, because, like I said, in some cases the boxes look very similar.
Okay.
And it's very, very easy to pick the wrong one.
I see. Well, Dr. Garcia, it's been informative talking to you. I appreciate the help. We've been talking about Pradaxa, its effects on the human body, consequences of errors, and what to do if you have some. If you're looking to research more, or you want to learn more about Pradaxa and its errors, I'd encourage you to see our website. It's worldwideweb.law-kc.com, or also look at our YouTube channel for additional videos. This has been Drug Error Talk, and I'm Matt Hamilton.